All right, 3, 2, 1.
Good afternoon and welcome. My name is Kate Schmidt. Good afternoon and welcome. My name is Kate Schmidt. I'm the Executive Director of Faculty Affairs and Development here at Pima Community College. We're the unit that houses the Teaching and Learning Center. We work collaboratively with all divisions at the college to continue to offer support to faculty and administration to improve teaching and learning. I want to thank Dr. Ricardo Castro-Salazar for his work with the Teaching and Learning Center to help organize this series. Today, I'm going to introduce my colleague and collaborator, Josie Milliken, our Faculty Senate President.
Welcome to another cross-discipline conversation where we come together to learn from some of the amazing accomplishments happening around the different disciplines at Pima Community College. The Cross-Discipline Conversation series is supported by the Faculty Senate and the TLC for the purpose of sharing faculty projects and programs with other faculty and administration while fostering collaboration and cross-discipline work at the college. This second event of the series, Opening Doors to Your Healthcare Career, features Brandy Randolph, Certified Emergency Paramedic, Program Director for the EMT program at the college. Brandy and I know each other from our work together on Faculty Senate, and as soon as I heard about his work with student volunteers providing COVID-19 vaccinations for Pima County residents, I knew that we needed to form our second cross-disciplines conversations around his and his students' work. We are very fortunate to have Brandy and several of his students here with us today, and also to have Devin Marble, Advanced Program Coordinator and Instructional Multimedia, and member of the Workforce Division, here to moderate the session.
Well, thank you, Josie. Sorry that the title got so long. It gets a little flippity floppity with the multimedia, right?
You might want to clarify your title.
So welcome, everyone. We're really excited to have you here to talk about how the EMT career can be a gateway to healthcare, or really a multitude of careers. And we're excited to have Brandy here with us. And what some of you guys may not know, I'm actually a paramedic as well. I started out as an EMT. So we're going to have lots to talk about. This is going to be a lot of good fun. And I just want to throw this out there for anybody who at the college is interested in being featured in a cross-discipline conversation. You have something you'd like to share and talk about, please reach out to Josie or Kate so we can get you guys on the list and start talking about how we can have you featured in the next cross-discipline conversation. So with that, let's talk to Brandy Randolph. Brandy, how are you doing today?
I'm great, Devin. Thank you. It's a honor to be here and share some of the things our students are doing.
So I think that you and I kind of need to just talk about one really basic thing, and let's just straight up define what an EMT is, because sometimes I think there's a little bit of confusion. We see firefighters and fire engines and ambulance drivers and ambulance companies, and they're all going to the same 911 calls and delivering at our emergency departments. But who are our EMTs and what is an EMT?
But the EMTs are truly defined as the backbone of emergency medicine. And an EMT stands for Emergency Medical Technician. They have the basic life support skills, which includes the automated external defibrillator. They can assist patients with several medications that they have. And really, we've seen the scope of an EMT over the over the last several years increase dramatically to the emergency care they can actually provide. And it's so much more than just driving the ambulance, right? These kids are actually, or I should say these students and young adults are actually providing some really definitive care for the patients who ultimately transport them to the hospital where they can actually receive surgery, the cath lab, whatever it is they end up needing. Those are the ones who recognize that information first, and of course, get them to the proper facility.
Right. And, in paramedicine, as you know, as a paramedic, we always say BLS before ALS. And BLS is really what we're talking about, basic life support when it comes to an EMT. And that's so valuable, just as a person who doesn't even want to be an EMT as a career, but wants to learn those basic life support measures so they can assist someone who falls on the sidewalk and feel confident about some of the anatomy and physiology they've learned. That was some of the classmates I went through with when I was becoming an EMT. And so it's really, when you divide the line, is that advanced medications, that's when you start to get into paramedicine. But we're talking about our students who are becoming EMTs and are saving people's lives. They're one of the first on the scene, and they're beginning an intervention that gets the heart back up and running again, and it provides oxygen and delivers them to their definitive care, which is so valuable. I wonder if you could talk to us a little bit about how EMT could be a gateway career to maybe other healthcare fields or otherwise.
One of the first things we do in class is when we're doing our introductions, we like to find out, who our students are, and then of course, why they're here. And, multiple students are interested in attending the Fire Academy, which is something that Pima Community College offers as well. They will potentially segue into the paramedic career, which again is another program that we have here at the college. But what we've seen more and more is people also getting interested in this because they want to go to med school, PA school, potentially nursing school, and EMT is so hands-on. EMT is hands-on in doing their clinical assessments, their medical and their trauma, dealing with oxygen and how they actually apply those devices properly and getting trained in the safe use of those devices. So it is such a springboard for multiple allied health careers across the college, and anywhere they want to take this knowledge, they can certainly build that foundation here. That's one thing we always stress, right? Is your foundation, just like you're building a house, right? It's solid ground and you can build up from there. So I always give the example that your EMT is the first floor. And then if you go on to firefighting, there's your second floor, and you continue to build that until you have just a fantastic home wherever it is they want to live when they get done with this.
Can you talk a little bit about how being an EMT could actually provide other skills for careers that may not be medically related? For example, the communication that you learn when you are treating and touching the skin of someone who really needs your help, and you may be an introvert. Can you talk a little bit about how EMTs get their feet wet with patient care and communication?
Some of the things we start from day one are those interview techniques, dealing with a patient, touching them, getting the vital signs. And so, we have awesome students that are here today that are going to talk about their experience, but I also have multiple teaching assistants that are here that I can tell you, I remember their first day. They were introverted and they didn't want to talk, but what I feel my job is we need to get those students up, and whether it's presenting something to the class or even standing up and expressing why they're here, starts, cracking that shell, right? So we can get them out of that. They can start to get comfortable. It's such a safe place in the EMT class. Everybody should feel comfortable. That's my goal as the director, is to make sure that there's the, just that willingness to share their information. And I understand students are going to be nervous when they're here, but we set the tone from day one that this is your safe place and we're going to make those mistakes, but we also need to communicate with each other, whether it's the student to the instructor or the students to the students. And I've just seen them grow and blossom, and it's been amazing over the multiple years that I've been doing this.
Yeah, and I want to touch on a little bit the idea that someone who starts out as an EMT because they're thinking, maybe I want to be a doctor one day, and how even the University of Arizona is beginning to implement their residents, their students, their medical students, requiring them to do some sort of hands-on EMT patient care training, so they are not just book savvy doctors, right? Not just really good at the labs and really good at the science, but really good at communicating in that bedside manner. Because at the end of the day, if you can't communicate with your person, you're not going to be able to figure out what's wrong with them. It's going to be very difficult. And I think that skill translates into any number of fields. Being able to communicate with people on a level that is personal and respectful and really kind of gets to the heart of the problem and the solution that you're trying to solve, right?
All right, absolutely. And it's just that, it's honestly, you have potentially 5 to 15 minutes to build that relationship with the patient. You have to ask them some, pretty personal questions. And if they don't trust you, I mean, you can be just the most book smart person in the world, but if they don't trust you in just that short period of time, you're not going to be able to extrapolate from them the information you need to make those informed decisions to let the hospital know what's actually going on. So yeah, relationship building 101 is kind of what we call it. Communication, documentation is important, but that relationship with your patient is vital. And hopefully they take that into any career that they decide to choose if it's not emergency medicine.
Absolutely. And how empowering is it to be working in an office or a manufacturing facility and you know what to do? Someone hurts themselves, they get cut, and like you're their coworker and you can go, I mean, I'm not an EMT as a career, but I know what to do and I'm going to come over and help you because that's going to assist our team in making sure that we can deliver whatever it is that we need to do for this job. If you're not safe in your workplace environment, you can't produce what you need for the company to blossom.
Right.
I want to ask you, we were talking about gateway careers. And so how did you get to where you are? You started as an EMT, is that right? Can you tell us a little bit about your journey?
Yeah, I actually took the EMT program here at the East Campus. It's been at East Campus for as long as I can remember. I know it did start at West, but when I went through, it was here. And after my EMT class, I was fortunate enough to be hired on with Rural Metro as a firefighter and continued with that firefighter career, decided I wanted to attend the paramedic class. So I was able to complete my firefighting, my paramedic, when we have also something, this is great that the college offers, it's the prior learning assessment. So I actually put in my paperwork and I was able to receive the Associates of Fire Science and Paramedicine from the college, even though I didn't take those initial classes here. Continued to take classes, became a hazardous materials technician, a tox medic, and it's been great. I love the career. I love the field. That's been 26 years ago that I started doing this, and then just kind of fell into the opportunity to actually teach and now run this program.
I love that you brought up PLA because that's at the core of what we're all doing here, right? This cross-discipline conversation. And people who don't know what PLA is, I didn't know until we actually got through Bellwether, and I really had to become educated in it. I met John and Gerard and Brian. And so PLA, for those who don't know, it's that prior learning assessment. It's you have this previous maybe skills trade knowledge that Pima will count as college credits. And I actually had no idea until just recently that also is included for some EMT skills in education. And I think that is so phenomenal because within Pima, there are gateways to your next career after you complete your EMT. Isn't that right, Brandy?
No, absolutely. And I was fortunate enough to be one of the co-chairs of that with Dr. Ian Rourke when we first started off. It was almost 3 years ago. And we knew the importance of that. And I think I'm a great case study in it because I used that. I had those credits and I was able to apply them and then obtain, additional 2 degrees from Pima College. Things that some people don't know what's available. And we need to share that information. And whether it was an EMT class that you took in Texas or California and you're interested in becoming a paramedic here, there is that potential to write for the prior learning assessment and then meet the requirements for entry into firefighting or paramedic, of course.
Now, I want to, if it's okay with you, I'd like to share my gateway path because I also started out as an EMT. And, I switched careers. I used to work in this kind of like multimedia a lot. And I really wanted to do something that was bigger than myself. And I wanted to give back in some way. And so I went to become an EMT and I went to EMT school. And really, I was nervous because I had to brush up on my math. We had calculations and conversions to do. It was mostly just division and algebra, but then I had to brush up on my anatomy and physiology. Lots of memorization. Like it really challenged me. I felt empowered when I was able to score well on an exam and go, holy cow, I can do this. And then going out and riding on my first ambulance ride along and seeing someone in distress, I feel that there's a moment where it kind of happens for you where you decide, is this even the right field for me or not? Because you see someone in distress and you either go forward or you recoil because it's frightening. And it's very rare do I see someone recoil, because once you learn the skills, you can't help but lean forward and help and try to help. And so that's what's so empowering about being an EMT. And I hear people all the time say, "Oh, I could never do that." And I go, "You actually could. You 100% could." Think about any time that a child falls in front of you and you don't think twice about bending over to pick them up. That's what that is. It's that initial gut reaction of, I know what to do. I'm going to lean in and give a hand. And I think that is what EMT did for me in my career. And then I moved on to be a paramedic. And I was on this path. I was going to go EMT, paramedic, and then I was going to become a PA or an MD. And I found love in this field of multimedia and education here at Pima, and really just wanted to stay. And it was such a wonderful journey of being able to start on this medical path that I just felt was giving back to the community, and I felt proud about. And then merging previous skills. And I got to be honest, I would not be here today if I hadn't become an EMT. That's what got me to where I am. And I'm super proud of that little certificate. I'm never going to let it go. Or I guess now it's a paramedic certificate. Could you speak a little bit to what courses could someone take at Pima after they complete their EMT? What do you get? You don't immediately get an associate's after EMT, do you? Where are you at
you do
in
not.
your pathway?
No, our certificate is set up as a certificate for direct employment. It's a 9 credit hour class, which is a required component for the paramedic degree. It's also required for entry into the firefighting, if they're going to work towards that Associates of Applied Science in either 2 of those fields. But it's also used as 9 elective credits at the University of Arizona. So there's multiple areas where that could be utilized. There's some conversations. We'll see where this can actually apply towards whether it's nursing or any other profession that we have in the allied field. But the 2 biggest ones are the firefighting and the paramedic. Those are definitely those credits that you move forward into your career and have. But it's just like you said, I would not be here either today if it weren't, for taking that EMT class back in 95 or whatever year it was. And it's just amazing how confidence, right? I mean, you're a perfect example for a student too. Yeah, right. The confidence just to know what to do, and more importantly, what not to do, right? You know what not to do in an emergency situation. And that's just, it's invaluable information. I mean, people need to have that. They need to know that. So congratulations on paramedic, of course. It brightens my day to see these, young, nervous students come in and just blossom into whatever career they choose to use this for. And some are just parents that want to know what to do if their kid gets sick. Spectacular. But we're just happy to be here and offer that opportunity. That's huge. Absolutely. And I definitely think one thing that EMT does is it demystifies the emergency, because I love what you said. Knowing what not to do in an emergency is so valuable. And part of that is not panicking, right? Is like, okay, because sometimes most people, you just zero in and it's scary. But when you have trained a little bit and you have learned, this is what I don't do, and I know that things are going to be on the right path, super empowering. And, I think this is a perfect segue to COVID, because we're all in an emergency environment right now, and we have been for the last year. So I wonder if you could tell us a little bit about how you guys, your EMTs, your cohort, you guys are contributing to the local effort vaccinating our community. And I heard the word TMC 10 pods, and I'm wondering if you could talk a little bit about that and what the point of distribution, that pod, what that means. So we've had some great opportunities with the community and building those relationships. One of the things, and honestly, when any situation comes about, you can dwell on the negative or the positive. And I will say we currently are not able to run with Boulder Ranch, TFD, AMR, and our typical partners. But through conversations with the health department and Tucson Medical Center, they actually put our students in a 2-week deployment where they were actually able to go out, and they weren't given the vaccines. They don't have that certification yet, but they could serve as the information provider to the patient, just helping people move through that pod in their environment. And I know the chancellor was so pleased that we give back to the community in this. So hats off to Lee Lambert for that. They've been very supportive about what we're trying to do here. but it's just getting them out in front of people, right? We talked about trying to break them out of that shell initially, and that's easier to do when you have to go on rotations with the fire department or in the emergency room. But since those things are all, off limits at this point in time, getting them in, again, my job is to try and look for opportunities and expose them to things that they can see and develop and talk to people that are out there potentially about how they move up in this career, what else they want to do. And so I feel like we've definitely done our job this semester. It's a challenging time, but we're here. We're a hybrid learning setup, but we're also hands-on, which is what coming from emergency medicine, this is what you need to be successful. I can't show you all of that on a computer, but you can certainly learn it here and then kind of supplement that when they watch some of our videos at home.
Now that we're talking about COVID, I'm wondering if you can just touch briefly on how are you training EMTs in a hybrid remote environment? How are you guys accomplishing? Because we're going to bring in some students here shortly. And I know that they're excited to come and talk. So before we bring them in, how are you guys doing this?
So we had a lot of support from Dr. Doré, Dr. Ian Rourke, and of course, Lee Lambert, where when we went on and just kind of understand the setup was we had spring break last year and it turned into a 9-week spring break. And that was difficult, but we obviously pushed to get ourselves back on the campus and making sure we followed all of the guidelines. Currently, how our setup works is our students check in. They check in at a centralized site here on the East Campus. Everybody is masked. And as we were talking earlier, sometimes I don't recognize my students because they don't have a mask on. I'm like, oh, that's who you are. So they come in and they're masked, and we've moved, of course, the desks. So again, if anyone that is interested in this program needs to realize that we only have half the slots available. We used to have 120 students a semester, but because of the social distancing requirements, we're down to 12 in a class. We did add a 5th class or a 6th class. So again, we can, hopefully meet the needs of the community. But they come in, they watch videos that we posted through our D2L shell. The first hour or so of class is just to clarify any questions that they may have. And then we spend a lot of time on skills, on medical and trauma assessment. Those are things I know Bridget can talk about later, but we were able to introduce those early into the curriculum. And now by the time they get to their practical skills testing, which is another component that we're required to do, we had a 100% success rate with our practical skills last semester. And in addition to that, our written exam, which is testing for National Registry of EMTs, that we were at a 92% pass rate, which is just fantastic that we're that successful with this group of students, and masks and whatnot, but we still continue to thrive in this environment. I'm just very proud of that.
That's awesome. And since we're talking about COVID, I have to give a quick shout out to the Allied Health Pima nursing program, which is also a pathway for an EMT. If you guys go from EMT and you decide you want to be a nurse, you can do that all through Pima Community College. But I got to do a quick shout out because when I got my vaccination, I got poked by a Pima Community College nursing student, and she did a phenomenal job. That was over at Banner Keno South Campus. And you guys are doing your pods over at Tucson Medical Center and main campus, right?
Yeah, the Tucson Medical Center has been our deployment site. I've been at TMC. I'm also part of the U of A pod that they have as a vaccinator. But again, it's awesome to give back where you can. And that's what people in this profession choose to do. So it's very exciting.
So we're going to be bringing in a couple of current active EMT students going through your cohort right now. They are El Nanjia and Zara Navid. And we don't want to make them too nervous. We're not going to ask them too many questions, but we're going to learn from them a little bit about what they're going through and what it's like and maybe why they've chosen this career. So I'd like to introduce you guys to El and Zara. If you guys could turn on your camera and unmute yourselves and say hello to everybody.
Hi, everyone.
Hello. I'm Zara.
So why don't we start with Elle, because I'm just going to kind of go in the way the grid is looks for me. So can you tell us a little bit about why you decided to become an EMT and where you see your career path?
Absolutely. So right now I'm studying physiology at the U of A. So I am looking to go to med school, and I'm really looking for something to give me those hand-on experience. And one of my things that I want to go into is emergency med, ER trauma surgery, like everything like that. And something a med school is going to look for, something I'm looking for my own confidence going into med school, is being very aware of the realities of ER. And being an EMT, you're the first person on scene. And I think that's really going to help me through the next few years.
That is awesome. And I applaud you, because we know that not only do we need first responders right now and in the future, but we're proving that the strain on our healthcare requires good emergency physicians with a good bedside manner. So very excited for you. And Zara, can you tell us a little bit about why you decided to become an EMT and where you see your path going?
Yeah, sure. So I'm also a full-time student at U of A. And I joined the EMT program because I wanted to get hands-on experience just like Elle. And I think this kind of hands-on experience you can't get anywhere else, not scribing or anything like that. And I want to volunteer as an EMT over the summer, get more experience with that. And I also feel like I don't know many people who are EMTs, and being in a hospital, you have a lot of collaboration between the different parts of the healthcare structure, and just being an EMT will show me a different side of that healthcare experience. So yeah.
That's pretty awesome.
Yeah.
I don't know how far along you guys are in your education, but have you seen anything, or have you learned anything that you feel that you can begin applying now to your normal everyday life from what you're learning from the EMT course?
I would say yes. Again, both Zara and I are studying pre-medicine, and we're learning very similar things in our physiology anatomy classes that we are in our EMT classes, you know, knowing the upper airways, lower airways, and it gives us so much more confidence in both the U of A and Pima.
Yeah, I would agree with that. And I think that moreover, like, we're learning the same stuff, but we're learning it in such a different capacity than ever we learn in our regular classes. And so the first day of classes, we learned how to do vitals, and I was so nervous. I was like shaking. I like didn't know what to do. And like I told my mom about that, and she's also a physician, and she was like, "What? You don't know how to do vitals yet? Like, that's so weird." And so I think just step by step, every single day, we're learning something new. We're gaining confidence in our skills and our abilities to eventually become physicians, hopefully.
So I don't know about Brandy, but when I first became an EMT, that first ride along was very daunting, and I knew it was coming at the end of my education. I had to go out there and do a certain number of hours in person and practice these skills on a real live person with a proctor, but I was nervous, afraid I was going to make a mistake or say something wrong, or I don't know, maybe they wouldn't like me, or maybe they would spot immediately that I was a student and they didn't want me near them during their emergency. How do you guys feel about embarking on that, knowing that you've got a ride along coming up ahead? You probably need to do one in the emergency department and one on the box. That's what I had to do. So Elle, are you worried? Are you nervous? Are you excited?
You know, I was just thinking about that yesterday because we just went through our virtual ride along. So COVID has limited those like in-person ride alongs, but we are offered a virtual simulation that I feel will be beneficial. But yeah, I'm nervous. I think everyone has to be nervous. You should be nervous. But like Brandy said, this class and this community has brought so much comfort in being confident and being ready to learn. If you make a mistake, if you're not ready, you can say something or you can back away. But really, I'm ready to put myself out there, and it's all about experience. So the more you do it, the more you will learn and get better.
Well, I just have one more question. Well, actually, Zara, did you want to speak to that as well before I go to the next question? Are you worried? Are you excited?
Sure, I can speak. I'm kind of bummed we don't get to go on ride-alongs this semester, but both Elle and I volunteered at TMC, and we had a great time talking to the patients and just calming them down, because our shift was to well, they had to wait there for 15 minutes to make sure they didn't have any reaction to the vaccine, and our shift was talking to them and just making sure that they're not going through any symptoms. So that was exciting, but definitely going through the actual ride-alongs and actually being an EMT is nerve-wracking, but I'm excited for it. I think I'll be ready by then.
So I just have one more question, and then I'll see if Brandy has any questions, and then we will let you guys get back to studying. But considering COVID, did that, when the pandemic arrived, did that make you guys nervous about choosing a healthcare profession? Did it give you second thoughts? Did you go, oh my gosh, maybe I don't want to be on the front lines. Maybe I want to be safe and cozy in my home and wait for my vaccine. So can you guys speak, Elle, can you speak a little bit to what was it like being a med student or an EMT student in the middle of a pandemic?
Absolutely. So for me, of course, you want to take those standards and precautions for COVID, but when everything started, I know Zara and my parents are both physicians, and I got to see their frontline work. I got to see my dad going to work every day with double masks, like just so ready to help people. And I saw how the community thanked and was so thankful for essential workers. And that just made me want to do something more. I actually added a public health minor when the pandemic started, because I was just so intrigued by how this is going to affect people. And then the EMT, of course, you don't know who you're going to be saving, or you don't know who you're going to be talking to. But I was lucky enough through TMC, my first shift, to actually get the vaccine, which doesn't happen a lot. But so through that all, I think I feel pretty confident, but definitely take all the precautions we can.
That's so cool. And how about you, Zara?
Yeah, I can't say that I wasn't more nervous going into this field after COVID hit and I saw my mom working really hard. But I definitely recommend, if anyone listening and is trying to go into medicine is getting nervous about these things, talk to someone who is actually in the field, and they will tell you that they do not complain. They don't feel like it's something that's too much to ask of them. They love their job and they're working to help other people, and it's not about them. It's just they love their job, and there's no reason to be so worried. Yeah.
Well, you guys are definitely going into a career field where we're going to need you forever. Talk about job security. I don't think a robot is ever going to be replacing an emergency physician or even an EMT. So thank you, guys. I'm out of questions. Brandy, is there anything you want to ask of your students?
Honestly, it's a thank you for being here, and you guys know about the pod experience and what you were able to learn and gain from that. Again, it's honestly, it's my pleasure to see you guys out there and learning those things that unfortunately we don't have the opportunity to put you into the hospital, but it's just been great. Now, are you both in physiology? Are you both physiology majors? Elle's physiology. What's Zara?
Zara's not.
Neuroscience, cognitive science.
Neuroscience. Okay.
Mhm.
Yeah, again, that was my daughter's path. She took the EMT course and works at Banner, Maine campus. And again, getting ready, and you'll all know all about the MCATs and the fun and excitement that can bring. But thank you for being out there and willing to participate in this. It's just, it's interesting to see y'all without a mask today. So, hey, yeah, this is what I look like, but just thank you. So awesome. Do you have any questions for us? I can't give you the Mod 3 test answers right now, but yeah.
No, I don't have any questions, but thank you, Brandy.
Awesome.
Yeah, thank you guys so much.
Thank you, ladies. I appreciate it.
Super excited for you guys to get your EMT certificate and move on. Please keep Brandy informed on your guys' healthcare path, and we're excited for you. And with that, please enjoy the rest of your studies. And I think it's time for us to bring on a graduate of the EMT program. So one of the things that we definitely want to make sure we include in this conversation is a student who has done this and has completed the program. So we're going to bring in a girl named Bridget Slagus, and she is a Pima EMT grad. And Brandy, can you tell us a little bit about what else she does? She's also an evaluator. She works there. Can you tell us a little bit about her?
Bridget, and it's good to see you, Bridget. Bridget is our National Registry Skills Evaluator, and she coordinates that as well, which means she brings on the teaching assistant. She makes sure that they're up to date on their skills. Bridget's also been spectacular in providing remediation where it was needed for some of our students who may have struggled with the registry test. So it's, again, an honor to have Bridget here with us today, and maybe she'll tell us a little more about what she's doing and how she's used EMT as a springboard. I know things, and I shared this with Bridget earlier, is that I talked to one of her cohorts, one of the students that was just, oh, wow, you know, Bridget, she's awesome. She's got some real confidence when she speaks in class and really knows her material. And I like to think just a little part of that came from her EMT experience.
Well, thank you, Brandy. That was quite the introduction, and it's an honor to be here today. It's nice to see you without your mask on. I know it's been a while for all of us. But yes, that's my bio. I'm a graduate from the Pima EMT program. I've been working there since graduating for about 4 years, and the last few years did indeed, as Brandy referenced, step up to the National Registry Exam Coordinator position. So I run the psychomotor skills, which is just a huge pleasure. It's a wonderful way, as a theme of today, to give back to the students and to have little tips and things that worked for us and what's commonly regarded as one of the most stressful evaluations leading to the EMT cert. Prior to the program through Pima Community College, I was a graduate through the U of A. I had a bachelor's of science in biology with a biomedical emphasis, and my goal was to gain the EMT cert in hopes of applying to PA school. And through the unbelievable privilege and opportunities that the EMT certification had provided me, I was able to fine-tune my path slightly and head towards the nurse practitioner route. So as Brandy referenced, I am currently in the Pima CEP program, which is the concurrent enrollment program with the BSN program through ASU, which is an unbelievable opportunity. And I'll be graduating with a second bachelor's in May of 22. So that is my bio.
Bridget, that is super awesome. Welcome. We're excited to talk to you. I have to break down some of these acronyms that we know, but we have to break down for some people. So first of all, psychomotor skills examiner, EMTs. So what we're talking about here is that you stand over students with a checklist while they do things like CPR and breathe for a mannequin, and they're envisioning a scenario that you're maybe reading to them or that you're testing them on. Is that right?
Well, that's the idea. So a little more fine-tuned than that, but yes, I will assign proctors for specific stations. We have a number of mandatory skills, those of which are kind of the orchestration and community collaboration of all of the skills are trauma as well as medical assessments. And those bring in oxygen intervention skills through different interventions and materials such as a bag valve mask, an on-rebreather, a nasal cannula, different devices that you would see in the field, as well as you referenced CPR. So those are the skills that orchestrate this symphony of bleeding control and traction and all of the other skills that EMTs will kind of use as a step-by-step to get there. And then, yes, we do have a checklist that we instruct them. We teach them how to appropriately perform each of those bullets and go through. We give them all a similar script and that I write each year. So all of my proctors have a script that they will test students on, and the students will go through each of those skills. And when they reach proficiency, that is the first step of their National Registry certification as an emergency medical technician. Once they finish the psychomotor exams, the practical skills applications of the EMT program, then they go on to test the National Registry written, which is a computer-based test. But that's pretty much the idea of their finalization to their EMT certification.
It's a symphony.
It is
I love
indeed.
My goodness. I mean, just listening to you talk, like this is the person that I want taking care of me if I'm sick or injured. So
Well, thank
super
you.
excited that that you started as an EMT and that you're continuing on. And I want to talk about that CEP acronym you were talking about. So you're an EMT, you graduate, and then you are now taking nursing classes at Pima Community College with the intention of, is that a large credit transfer? Does ASU transfer more credits for you to become a nurse practitioner? Can you get a little bit more specific about how you're bouncing and moving forward on this career path all the way through to your degree?
Of course. So one of the great things about the world that we currently live in, although there are restrictions and drawbacks with the virus, is so many different online programs have developed, and there is much less of a stigma of online programs versus in-person programs than when I initially went to school. And Pima is one of those elite upper education and higher education programs that will truly meet you wherever you are in your career and provide some pathway in order to get you wherever you want to go. So I have taken full advantage of that, starting with the EMT program. And then on graduation, I did apply to the Pima associate's degree nursing program. And with that, after completing my first semester successfully in the nursing school, I had the privilege of applying to the concurrent enrollment program to have the Bachelor's of Science in Nursing through ASU. So upon completion, it's going to be concurrently running that I will take some courses at ASU in addition to my course load with the associates for the Pima Nursing School. And I will graduate with the ADN as well as the BSN. And that will hopefully point me on my trajectory to applying to the Doctorate of Nursing and the Doctorate of Nurse Practitioner at another higher association. So I'm deeply looking forward to it, and truly, it's a terrific opportunity to be able to go anywhere with this baseline foundation of education.
Well, I'm really excited for you. I know being a nurse practitioner is a really exciting goal. I mean, you could have your own practice one day, which is so cool. Do you know what you want to specialize in?
I'm not sure yet. So hopefully I would like to get into the ED or the ICU and perhaps have my critical care nursing cert prior to heading to nurse practitioner. And especially in Arizona, nurse practitioners, as you referenced, have a huge level of autonomy, which is one of the driving factors as to my personal journey, why I selected the NP rather than the PA route, as you're able to operate without the direct shadowing of a physician. So having your own practices is absolutely a possibility. And I think that a lot of people, such as Zara, who's somebody that I've worked with closely in my classes, their goal is to be kind of the highest level of scope that they can in medicine. And for those that MD isn't the correct route, the next level of scope that provides you the highest possibilities and capabilities within the hospital would be the NP or PA.
Well, I'm nearing the end of my questions for Bridget. So Brandy, if you have anything, I just have one more, and that would be, what would you say? Do you have any thoughts or advice for someone who's considering EMT and as a springboard and how it can take them on a career path? Do you have any advice for a new student?
Oh gosh, well, I think Brandy and I both know our advice goes throughout the duration and the entirety of their experience within the EMT class. But I would say that oftentimes, as we've referenced all today, especially having the prior EMT experiences, that it can be a daunting task. But just if it's something that you have a passion for, to stick with it and to work hard and to have that big level of perseverance. But that would be my main encouragement for students to give it a try and maintain that perseverance.
Well, no, I think that's awesome. It's awesome advice. And what's important to realize about the EMT program is that everyone we have that teaches here, whether they're the adjunct or the testing coordinator, they went to class at Pima College. And so it's just a fantastic opportunity to see everyone giving back and, watching we talked a little bit about this before you were here, Bridget, the introverted students who might not have as much confidence, how they're able to really blossom in that because we don't throw them in the deep end first, right? It's kind of like dipping your toe in the water. Okay, and then today it's going to be your foot, and by next week, they're going to be fully engulfed in that, but they're going to have those opportunities to thrive at each and every one. And that's how you build confidence and make students comfortable at what they're doing before they go out and actually, touch the real patient. So again, for that, I thank Bridget for coordinating those skills and being awesome at absolutely everything, and in particular, her job here with us. But it's been such a pleasure to work with her for the last several years. And all I can say is thank you. So yeah, thank you, Bridget. It's awesome.
Thank you, Brandy, truly, for everything.
Well, Bridget, we will let you get back to all the hard work that you're doing, and I'm sure you've got some studying to do. And so
I do.
Thank you so much. Thank you for joining us.
Yes, thank you. And I appreciate seeing you all. This was a terrific opportunity. And please all wish me luck on my nursing exam for tomorrow. Thank you, guys. Thank you. Thank you, Brandy.
Well, Brandy, I think there's really just one topic that we wanted to make sure that we covered before we wrapped up this cross-discipline conversation. And it was a little bit about how EMT really is a community profession. And you and I have talked about it before, EMTs give back. Can you talk a little bit about some of the community relationships that you work on in conjunction with your EMT program at Pima Community College?
Absolutely. The relationships are built over time. And again, that's what really segued us into the, working at the pods. This is the relationships with the health departments and Tucson Medical Center. I've worked at Tucson Medical Center and the different fire departments throughout my career. We have relationships with Golder Ranch, which I'm proud to say their chief right now is one of the students I went to EMT class with some 20 plus years ago. And being able to get in, and when those things do come back, as far as the ride-alongs or the vehiculars, it's great. But those are the relationships that we have in the community. We volunteer. We're part of, and it was actually kind of sad. We missed the Safe Halloween this year, which is something that is done at the Clemens Center. But that's usually where we take our ambulance and we, hand out candy to the kids, and we also serve as the first aid booth for that. But those are things we've done for years, and it's just, sadly, it's been missed for at least for the last year. But we will continue to build those relationships, deal with the pre-hospital coordinators, know that we're always available for any and all things that they have to offer, because that is one of the most important things we can do right now, right? Is give back to that community, and we continue to have the support of the college to do such things, and that makes it so much easier. I don't know if you have the slide ready to bring up, but if we also talk a little bit about the AZ ESAR VHP, is that the volunteering, not just for students, but anyone that's interested in volunteering can register through this system, which is an opportunity to get back. Or maybe you don't know what you want to do in your career. What this site is, and thank you for bringing that up, Devin, and I have to read it from my list, the Arizona Emergency System for the Advanced Registration of Volunteer Health Professionals. Now, I don't want the name to scare anyone away, because if I'm a potential EMT student, I'm like, oh, well, I'm not a healthcare professional. That's my goal. But within this site, there are specialty groups. I happen to be part of the Medical Reserve Corps that's actually giving the vaccinations. There's, again, subspecialty groups in there. But what was awesome is that anyone can participate in this, right? Anyone that wants to, again, quote, get your toe in the water before you jump into the deep end, you can kind of see what's actually happening there in the pods. Again, a pod is something that comes up in chapter 40 when we teach this in the EMT book, but we've never had these before, right? We've never had to do a mass vaccination and have all 50 states working in that. So it's a great opportunity. They're, 5-6 hour shifts, but you have to register through that site, and then you can be on the contact list for non-medical volunteers. Medical volunteers, we pretty much know how to set up our own sites, and we get different emails, but just a fantastic opportunity. And as part of this community, I encourage anyone and everyone to be a part of this if this is something they have the flexibility to do.
Well, we talk about this being a community profession and being able to give back. And I want to really stress one thing you said, potential EMT, meaning you don't have to be an EMT to do this volunteering, and you can contribute to our local community in this vaccination effort, or learning on how you can be a part of, I guess, the next response if there is one required. And so another wonderful thing about becoming an EMT and doing it specifically at Pima Community College, where you have all of these local and community relationships set up so your students can be involved in the local vaccination effort and locally volunteering, and really, really valuable stuff. So we encourage people, if you're interested and you just don't even know what it's like, to reach out and to these folks and see what it is you can do and what you would be interested in. Because I think that's really what this cross-discipline conversation is about. It's not just the springboard to your healthcare career, but it's also about being a part of something that gives back to the community. And that's a really, I guess, valiant career choice. And so I applaud you, Brandy, and you're still an active paramedic working in healthcare, right? You're still treating patients. Is that correct?
I'm doing vaccines.
You're doing
and again,
vaccines,
because
right? And then
kept my certification, because you never know when the skill is going to be needed. So
Absolutely.
I keep that cert up and keep it current. Just
all of our paramedic instructors are active duty working paramedics or firefighters, and a lot of the EMTs, right, are becoming EMTs because they're going to become a firefighter. And just these are people out in our community. So really, really glad that we were able to sit down and talk about this and kind of demystify it for people.
Absolutely. And thank you for being a fantastic moderator. It's been an honor to be a part of. There's so many things we didn't talk about, such as our volunteering with the soccer group that we had. We do that, all the equipment that we're spoiled to have. So again, I just hope hopefully anybody that watches this and they're interested, we'll get them the information. We'd love to give, tours as appropriate. Obviously, we're in a kind of a different time, but we have a fantastic staff that, Yolanda, Heather, and Cole. I could not do this job without any of them. Bridget, any of them. It takes a team to accomplish something like this. And again, hopefully we'll be able to get more people in here and show them around, where our doors are, quote, always open when it's appropriate, but love to show off the equipment we have and show everybody what we're doing. Just awesome to be here.
As we wrap this up, I'm sure Josie and Kate may want to say some final words, but I want to make sure that we thank Josie and Kate for creating these cross-discipline conversations brought to you by the Teaching and Learning Center. And I want to thank some of the other people that you guys actually aren't seeing right now, like Dan Pinard with PCC TV and Glenn Holland. John D is helping us out with our tech behind. We have Ricardo, who's helping us out behind the scenes over here. And we also got to thank Kimberly August, who is our furiously typing all of the words that you're seeing at the bottom. And she's probably very thankful that we didn't say something like supercalifragilisticexpialidocious. Sorry about that, Kimberly. So just thank you to the whole team who helped put this on and letting me be a part of it. Josie and Kate, did you guys have anything you wanted to add to this closing?
Well, I think we want to say thank you to you as well, Devin, for moderating these sessions and bringing your spark and life to them. And thank you so much, Brandy, for giving us all a better understanding of the EMT program and also a glimpse into the present and future of your students. And thank you, Elle, Zara, and Bridget, for making time in your busy lives to speak with us. You truly exemplify the community in Pima Community College and are all doing such beautiful work while leaving an indelible impact on the community.
Josie is so eloquent. I second her thank yous to everybody, and yours as well, Devin. Thanks for your service as the facilitator. And I think Ricardo's working on planning a few more of these cross collaboration discussions in the next few months. I know he's been talking to the theater program, the culinary program, and our journalism program.
Well,
So
that's very
those times and dates will be announced as we get them scheduled.
Well, that's all the questions that I have for all of you wonderful people today. And thank you everybody for watching and everyone for being here. I think that's all she wrote for today's cross-discipline conversation.
Perfect. Thank you.
Thank
Thank
you.
you, everybody.
Thank you very
Till
much.
next time.
All right, so I will be
Cool.
closing the event. Is everyone good?
Yeah, I
We're
think we're
good.
great.
Okay, awesome. Well, I will